I have seen diagnostic and surgical prototypes for AI for a couple of decades, and I think it's pretty clear these systems have been prototyped in military settings when soldiers are down in the field. It's too dangerous to get, or a medical professional can't get to that location. You can use AI to do a diagnostic and make sure you understand how to safely transport that patient to a surgical unit, or how to properly assess the damage that has been done to a human body. But when you get to the point where you're doing remote surgery, that's a different risk level, and those are circumstances where it is almost always included that there are redundancies in place for a power outage or an optical outage or any other interference in the communication between the surgeon and the patient during that process. So I think those are very easily identified and most often mitigated before the system is launched. And that's very different if you contrast that to something that is less risky, like going to the optometrist and getting an eye exam. If the power goes out at the mall where your optometrist operates, that's something where they might just reschedule the appointment. It's very different because the risk to human life is on a very different scale. So there are some circumstances where a power outage is an inconvenience. There are others where it can be a life and death situation, and those are often anticipated ahead of time and prepared for appropriately.